So next up we have the founder of the UNC AR/VR group and also the founder of the NC Triangle Region's Health 2.0 group, which has 1,300 people working in health technology and innovation, and also the head of health technology and informatics at the Health Sciences Library. And by that I mean me. So can you bring it up?
You need to update your Who slide.
Yeah, that's true. Yeah, this is Doctor Who, not quite fully accurate version of Doctor Who. So for this, I'll just give a little, so I get 1 second of it. All right. I was inspired by Dr. Eric Topol. If you go to his Twitter feed, you'll see his pin tweet that he's had it for a long time. It's something called Your Medical Data, and it basically is a form of it's basically a patient video manifesto about how patients should have their own data. So for the first time ever, this will be presented to you, a crowdsourced version of that we created here at the Health Sciences Library of that talk. So let's.
It's your body. You paid for it.
It's worth more than any other type of data. It's being widely sold, stolen, and hacked, and you don't know it.
It's full of mistakes that keep getting copied and pasted that you can't edit.
You are and will be generating more of it, but it's harmless.
Your medical privacy is precious.
The only way it can be made secure is to be decentralized.
It is legally owned by doctors and hospitals.
Hospitals won't or can't share your information. That's information blocking.
Your doctor won't give you a copy of your office note. You're far more apt to share your data than your doctor.
You like to share it for medical research, but you can't get it.
You have seen many providers in your life.
No health system or insurer has all your data.
Essentially, no one has all of their medical data from birth throughout their life.
Your EHR was designed to maximize billing, not to help your health.
You are more engaged and have better outcomes when you have your data.
Doctors will be given full access to their patients' data and make this a routine.
It requires comprehensive, continuous, seamless updating.
Access or control of your data is not adequate.
Around 10% of medical scans are unnecessarily duplicated due to inaccessibility.
You can handle the truth. You need to own your own data. It should be a civil right. It could save your life.
It could save your life.
Your medical data. So thank you for Bob for putting that together, and for many people in this room for being part of it. How can you bring up the slides? So I just wanted to take a moment, and in this turn to part of what we're doing here in the schedule, to talk about what we're doing for digital health at the Health Sciences Library. So digital health at the HSL. So I'm Brian Moynihan, head of health technology and informatics here at the Health Sciences Library. This is a little overstated, but I think it's true in general. Bad libraries build collections, good libraries build services, and great libraries build communities. I think you've heard this as a theme. If anyone who's been listening to me for the last couple of years, this is almost the only thing I talk about, but certainly today. That we need to build communities, connecting people across. That's why I'm so happy that you're all here today. So I think it's overstated. Bad libraries don't only build collections. We definitely need collections and services, but I think we should be moving towards how we can use them in the community in a meaningful way. Over time, we've created digital health at the Health Sciences Library. This started off as kind of a pilot effort, and now it's become a full-fledged part of what we do. This is our first digital health symposium, but I'm really hoping it won't be our last. So one of the things that got us started when we were doing it as a pilot, it was new to the HSL, it was new to the School of Medicine. We put together CADRI, the Carolina Digital Health Research Initiative. If you're not on our bi-weekly newsletter, then please get on it. It would be great because we always spread news about what's going on here, including local events and news, and talk about our digital health collection. But some of the goals here that we've had from the very beginning, which is to be a connector, is still there. We've had a number of workshops and seminars. I think we've had more than 15 over the course of a year and a half or so. We've had devices for research studies and a number of consultations. So accomplishments, we worked with Robert Furberg on the Fitbit study, also with the School of Public Health, and put together the Robert Wood Johnson Foundation protocol we talked about. We're in the process of creating a digital health database on campus of everybody who's working in digital health in one way or another, so that we can contact each other and help build the community. We have websites, we've done news stories, we've done flyer outreach, we have our bi-weekly newsletter, we have health resources, we have our device collection brochure, which you can pick up in the back in the library catalog. And in our device collection is a pretty impressive list of stuff. This is a screenshot from our website, but in categories such as sleep trackers, voice assistants, digital stethoscopes, air quality monitors, and it just keeps expanding. Some of the example projects we worked on, I think it was mentioned earlier today, but using EEG headband, the Muse, which is a $250 headband that you can get, that has been one of my favorite devices because you can do a lot with it. So thinking about biometrics, not just as something that people can use to understand their own data, which is incredibly valuable on a, like you do your Fitbit and a month later you figure out what you did, but also for live biofeedback. And so someone can understand what their heart rate, respiration, electrodermal activity, and control that. And beyond that, this is where it gets really interesting for me, as an input to other software. So how do we use heart rate, such as I mentioned with this thing, that what app couldn't use this, right? What app couldn't use your heart rate? Say you're checking your email and suddenly it's a letter from your boss and you're like, oh, and you start freaking out, your heart rate's pounding really fast, Then maybe it shuts down your email, gives you a 30-second, you meditate, and then you come back to it, right? And speaking about this, well, what do you do with brainwaves? Well, with brainwaves, one thing you can do is get your live biofeedback, and so we've done that. But another thing we're working on now is really this a control base. Imagine somebody who has locked-in syndrome, so they're conscious but they can't otherwise move, they can't even blink their eyes. You could use this to control things that can control a game, could control an interface. And how do you create very simple interfaces that have nothing but a next button and an enter button? So you might have option A, option B, option C, and back. And to choose from, you say next, 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 and you flip through those, and then enter when you're ready. So even with a binary, I'm inspired by things like Morse code, hence a Morse code wearable. with just a binary on/off, you could say anything that could be said in human language in any language. Research can really start blowing things open. And I think health has all sorts of applications for this. So I won't go through all the different things we've done, but we've done a number of different interesting studies that we've supported. We've also had a number of events. You might recognize Robert again. He gave our very first talk in Agile Science, but we've had talks in privacy, about use of data, about software, about devices, and a whole range of things about digital health, and these are going to continue. Even today, I'm flagging down some people in the audience and saying, oh, you need to come talk about our next talk, so we'll have some more interesting ones coming up in the coming months. One area this has sort of brought us into is augmented and virtual reality. So seeing that there are a lot of people on campus who are interested in augmented reality and virtual reality, I put together the group of AR/VR group on campus. It's now at 130 people, and I'm proud to say that it's like students, faculty, researchers, staff members, and it includes people from health affairs, from humanities, social sciences, technology, athletics, in the Moorhead's planetarium, and it's all over the place. And this has been a really active listserv where people are learning about best practices in doing that. And what's interesting to me about this is it's a blue ocean. It's a wide open field that if you're thinking about research, thinking about education, if we're talking about clinical care, or if we're talking about commercialization, it hits all those fronts. And because it's a team science, because this all has to be done by a group of people who have different things that they can bring to the table, I think it's extra right for a community that engages around that. So I'm excited that the library is that institution and can be a place that all those things come together. So an example of, we got our first HoloLens, which you can try out in the other room there. We got our HoloLens as a result of supporting a collaboration between a surgeon at UNC hospitals with UNC computer science and trying to figure out how you can take, for instance, an MRI scan, which is normally this sort of 2D image where you can get a blob and that must be the tumor, stretch that into 3D, and you can see how that tumor would look in 3D. You can take that 3D model and superimpose it with augmented reality over someone's head and understand as they move their head where the tumor is. And ideally, if you do the vasculature and other things going around that, so you can do surgery planning, you can do live surgery, etc. So Adrian, amongst others, is working on that project and can describe it better than I can. And if you're interested in this area, there is currently an interinstitutional grant across the UNC system, so UNC Chapel Hill, but also UNC Wilmington, NC State, Winston-Salem State, UNC Greensboro, et cetera, who are all thinking about how can we get together and work on a virtual reality for human health. And so some people are coming at that from different directions. Some people are interested in virtual reality as a way of understanding falls and gait. So they'll have people walk on a treadmill, and they'll have a wraparound screen that looks like a hallway to them, and suddenly the hallway tweaks and falls over, and somebody's gut reaction is to react. Well, with that, you can study falls, and you can understand for older people, younger people, people who are prone to falling, those who are not prone to falling, a way of studying human health and making things better. So that's one example, but I think it also goes the full spectrum that this is being used for people for all sorts of psychological conditions, and we can explore things that people haven't thought of yet. So that's my quick summary. If you want to contact me, I'm Moynihan at ed.unc.edu or just digitalhealth.unc.edu. And you can check out all the digital health things that we do at the Health Sciences Library at our website, so hsl/live.unc.edu/digital health. Thanks.